Support for the Legislative Gazette comes from New York State United Teachers, working to support students, educators, and public schools as the center of their communities through the Public Schools Unite Us initiative. And United University Professions, representing 37,000 academic and professional employees at SUNY campuses and teaching hospitals across New York State. Frederick E. Cole, President. UUPinfo.org. The Trump administration is blocking an offshore wind project in New York from moving forward. Jung Yoon Han from the New York Public News Network reports.
On Wednesday, U.S. Secretary of the Interior Doug Burgum ordered a halt to Empire Wind 1, which is off the coast of Long Island. The project, which is located about 14 miles from Jones Beach State Park, is slated to begin operating in 2027. It would be the first offshore wind initiative to connect to New York City's grid, and, combined with another project, it's expected to provide power to more than 1 million homes. In issuing the order, Burgum made good on a campaign promise from President Donald Trump by attempting to halt operations for offshore wind projects. New York Governor Kathy Hochul decried the order and said it stands to threaten 1,000 union worker jobs. In Albany, I'm Jung Yoon Han for the New York Public News Network.
New York State prison officials say they'll review the correctional system's culture after 10 employees were indicted in connection with an inmate's death. WNYC's Jimmy Vielkind reports.
It's the second time in less than 2 months that officers were indicted for their role in the beating death of a prisoner. Corrections Commissioner Dan Marticello condemned their behavior.
There's no place for violence in the correctional system, regardless of who perpetrates the crime or the violence inside of our institutions.
Prosecutors say officers beat Messiah Nantwi last month at the Mid-State Correctional Facility with, quote, fists, batons, and boots. He later died from his injuries. All the officers pleaded not guilty to the charges Wednesday. Their union called the indictment, quote, extremely troubling. In Albany, I'm Jimmy Vielkind for the New York Public News Network.
You are listening to the Legislative Gazette, a program about New York State government and politics. I'm David Gistina. This week, I sat down with Dr. Don Levy, director of the Siena College Research Institute, home of the Siena Poll. Their latest survey takes a look at New Yorkers' opinions about the COVID-19 pandemic 5 years later. Among the findings, many New Yorkers prefer not to think about the pandemic and act like it never happened.
It says something about us, doesn't it?
Sure does.
We went through this profound collective trauma. There isn't a person among us who wasn't affected by COVID-19, by the pandemic. Yet when we ask people numerous questions about how you feel about it, but you're pointing to one question that says 43% of us, 56% of young people say, you know what, I don't want to talk about it or think about it anymore. I try to act like it didn't even happen. So there's a sense that we're trying to put it in the rearview mirror, but it did happen. It's really impossible to put it in the rearview mirror. Part of it is we're mad about it. A large percentage of people, 57%, said that when I think about it, I get angry because the disease robbed us all of 3 or 4 years. So we may try as much as we want to say it didn't happen. It did happen, and many of us are angry about it, and many of us are changed in a variety of ways.
Well, now let's take a look at how the survey parses out people and their feelings about the shutdown itself. You know, some felt more isolated. Some feel that it's more time with family. Others are angry about the whole thing.
Yeah, I think you get the full gamut of reactions. Sort of a framing question was, when you look back, was there some good and some bad that came out of it? 2/3 of people agree with that. People's experience, I think, we had about 2/3 of all New Yorkers said that they or a family member had COVID. Over half of those people said they had it more than once. So it was thoroughly widespread. On the positive side, there's a sense that it allowed some of us to deepen our relationships. We had 64% feel as though they deepened the relationship with people that were most important to them. Yet at the very same time, and this one really jumped off the page for me, that COVID resulted in people feeling more isolated and alone than they have ever felt before. A majority, small majority, but still a majority, 51%, agreed with that statement. And even when you scan across the crosstabs, 63%, nearly two-thirds of young people say that they ended up feeling more isolated than ever before. I don't think we know yet the long-term impact that COVID had on young people, whether they were in preschool or all the way through college. Their lives were fundamentally changed. There's certainly a sense of dissatisfaction with how the educational system responded. But at this point, most specifically, that group of people, young people, say they ended up feeling more isolated than ever before. And in fact, we even asked people, did you have any emotional or mental health problems that you would associate with COVID? 37% of all of us, and that is typically a kind of number that's a little understated. There's a reluctance of people to admit that. But that number jumps about 10 points amongst young people. It was hard for them, being isolated, having their lives changed, for many no longer being able to interact with friends, to getting their schooling remotely, depending on at what stage of their educational life they were at, completely changed. It appears that that's had a lasting effect. And then you dovetail that with technological changes, the centrality of the digital world. I think that's happening at the same time as coming out of COVID, but it is eye-opening that 51% of all of us and nearly two-thirds of young people say they came out of COVID feeling more alone, more isolated than ever before.
That's Dr. Don Levy, director of the Siena College Research Institute, home of the Siena Poll. You are listening to the Legislative Gazette, a program about New York State government and politics. I'm David Gistina. The SUNY chancellor was in Plattsburgh this week to sign two agreements advancing the move of Clinton Community College onto the SUNY Plattsburgh campus. The Legislative Gazette's Pat Bradley was there and filed this report.
In January 2024, officials at the community college announced that it would relocate its programs, faculty, and students to the SUNY campus a few miles away. On Tuesday morning, SUNY Chancellor John King Jr. signed agreements with college officials formalizing the partnership.
First, we are taking steps to formalize the relocation of Clinton Community College to the SUNY Plattsburgh campus. This move will generate critical savings, support academic and operational sustainability, and create a learning environment that benefits both institutions. It also allows Clinton County to reimagine the Bluff for community use and potential development. Second, we are advancing a key component of Clinton's relocation plan, the college's new partnership with Champlain Valley Physicians Hospital. By placing Clinton's nursing and EMT programs inside a premier medical institution, we're delivering a truly immersive learning experience.
King noted that the move was motivated by declining enrollment and a requirement that the college improve its fiscal standing or lose its accreditation.
I'm proud that this community did not retreat, it rallied. Clinton took bold steps, SUNY Plattsburgh stepped up. Local leaders and SUNY staff locked arms to find solutions. Collective action has paid off. Clinton's accreditation has now been reaffirmed through 2030. Enrollment is growing again. Donors are returning. Clinton has a path forward and a home that will allow it to thrive. Today, we spotlight the roadmap for how institutions can adapt and thrive in the face of challenge. Today, we celebrate what's possible when public higher education leads with urgency, creativity, and care.
Administrator in charge, Ken Kennelly, said faculty, staff, students, and community partners saved Clinton Community College.
It's not an overstatement to say that collectively the people in this room have saved a college. We had to increase enrollment and gain reaccreditation, and we did that. I've said before, could Clinton County survive without a community college? And the answer is it could, but it would be a branch office with gaps no one else would fill. But we don't really have to worry about that. The college does matter, and it's here for generations to come.
SUNY Plattsburgh President Alexander Ignetti says the co-located campuses offer a tremendous opportunity to enhance the region's economic vitality.
Today we celebrate partnerships that are instrumental in serving our students, enhancing our workforce, and expanding opportunities within our region. This is an effort that reflects our shared dedication to student access, student success, and regional success. Together we are creating pathways that will benefit our students and strengthen our communities. These partnerships are a clear demonstration of SUNY's commitment to local impact and its role as a catalyst for regional development.
Chancellor King is excited that this fall a new and revitalized Clinton Community College will open on the SUNY Plattsburgh campus.
This will be the first time that we have a community college physically located on the campus of one of our four-year institutions, but close collaboration is not uncommon. And in fact, Plattsburgh has a very close partnership with Adirondack Community College, for example, where there's a satellite campus of Plattsburgh on the Adirondack campus. So we have many close partnerships, but this is unique, the co-location of two institutions.
A second agreement formalizes a partnership with the CVPH Medical Center, located a few blocks from the campus. Clinton Community will co-locate its nursing, EMT, and paramedic programs at the hospital. For the Legislative Gazette, I'm Pat Bradley.
An annual report from the First National Horse Racing Regulating Body finds racing-related deaths are down at tracks it oversees. The Legislative Gazette's Aaron Shella-Levine takes a deeper look.
With less than a month until the Kentucky Derby kicks off Triple Crown season, Horse Racing Integrity and Safety Authority officials say they continue to improve conditions at regulated tracks. CEO Lisa Lazarus presented collected data from 2024, including a fatality rate of 0.9 per 1,000 starts at nearly 50 tracks in 19 states.
It's a 27% decrease from last year, 35% from when HISA first launched its first racetrack safety program, or I should say first launched the racetrack safety program, which was the first of its two programs. And then, as I said, the decrease started, well before HISA, and it's more than 50% since 2009, when the EID began reporting racing fatalities.
Lazarus also emphasized the difference between HISA-enrolled racecourses and those that have not yet signed on with the regulating body.
The HISA tracks have had a consistently lower fatality rate than the non-HISA tracks overall. There are some non-HISA tracks that are consistent with HISA tracks, but there are obviously many that are not, and that have much more concerning numbers. Unfortunately, the trend that we're seeing is that as the HISA tracks improve their safety metrics, the non-HISA tracks are getting worse.
According to the report, non-HISA tracks saw fatalities increase from 1.63 per 1,000 starts to 1.76 per 1,000 starts from 2023 to 2024. Tracks, including those on the circuit run by the New York Racing Association, like Saratoga Racecourse, have faced mounting criticism in recent years for high-profile horse deaths. The congressionally authorized HISA is overseeing efforts to improve racing surfaces, implement anti-doping measures, and improve health screenings for horses. Beginning last year, HISA also began to track training fatalities, coming in at 0.5 deaths per 1,000 workouts.
We talked a lot about what the denominator should be for training fatalities. We ultimately settled on published works. Unlike starts, it's an imperfect denominator because we do actually include, as I said earlier, horses that gallop, horses that are doing any exercise activity on the backside when they're injured.
Lazarus adds that there wasn't much of an increase in scratches or horses being pulled from races following HISA's implementation.
If you compare the first 30 months of HISA to the 30 months prior, which were not under HISA, you have less than a 1% difference in scratches nationally. Now, that's a national number. It doesn't reflect what's happening on individual racetracks.
New York Racing Association Vice President of Communications Pat McKenna says in collaboration with HISA, NYRA has, quote, adopted new technology, increased veterinary scrutiny on all horses training or racing, and continued to refine track maintenance practices, end quote.
It is incredibly encouraging. There has been a 55% reduction in the most serious equine injuries since 2009, and that is also reflected here in New York, where Saratoga had the safest year on record in 2024. These are sustained and significant enhancements.
Saratoga Racecourse had 0.6 fatalities per 1,000 starts last year. The Belmont Stakes will be run at Saratoga for a second time in June. With an additional July 4th weekend of racing, the Spa will host a record 49 days of racing this year. For the Legislative Gazette, I'm Aaron Shello-Levine.
You are listening to the Legislative Gazette, a program about New York State government and politics. I'm David Gistina. Comptroller Tom DiNapoli says New York State should improve its storage of durable medical equipment purchased during the COVID-19 pandemic. An audit released late last week also says the state distributed only a small fraction of the equipment at its disposal. The Democrat says equipment including ventilators and X-ray machines that are sitting in storage facilities are missing recommended maintenance and costing taxpayers storage expenses. According to the report, the state paid more than $452 million to purchase more than 247,000 items of durable medical equipment during the pandemic. Only 3 items purchased during the public health emergency period were distributed. The Legislative Gazette's Lucas Willard spoke with Comptroller DiNapoli about the report.
We all remember what a time of crisis it was and a real need to get durable medical equipment to really help deal with the consequences of COVID. People in the hospital, people very sick, people dying. So the state ended up spending about $450 million to purchase about almost 250,000 items of this durable medical equipment. And the challenge that we found in looking back at the process to purchase that equipment, we found that the traditional kinds of reviews that would normally happen with a state procurement were suspended. Again, it was an emergency situation, but because of that, it would be fair to say that much was being paid for without normal review. It ended up out of that 200 almost 50,000 items, that of the new items purchased, only about 3 of them were actually ever used. So fast forward to today, and what we have is in effect a stockpile of this unused equipment that was purchased during COVID. And, I think that was the most important takeaway from our audit of not just looking at some of what perhaps went wrong in the beginning of the pandemic, but more importantly, what are we doing moving forward to make sure we're better prepared in terms of having an appropriate stockpile of this equipment if, God forbid, we face another health emergency like COVID down the road.
What kinds of facilities are these pieces of equipment being stored in? Are they in warehouses, buildings? What's the storage situation
exactly.
like?
Yeah, there are warehouses that Department of Health maintains and Homeland Security, and one of the concerns we have is that there was an analysis that at some point was made that suggested that about 51,000 of these items would be an appropriate level to stockpile. So you have equipment in there that's not being used that I believe there are hospitals and health facilities in the state now that could use that. In fact, there was a survey done and there was a response for some of this equipment to be requested, yet they haven't moved it out of the warehouses, so you're incurring a cost. another issue that we identified is that some of this equipment obviously needs to be going through routine maintenance to make sure that it's staying in a state of good repair. Again, if God forbid it has to be utilized, you want to make sure you maintain the equipment because there are certain warranties that might lapse if you're not maintaining the equipment. We see that they are not providing the kind of maintenance that they should be providing. So what we're really recommending to Department of Health is that they have a better management of the stockpile, not only in terms of the quantity of what they have, so they can reduce the cost of warehousing, but also make sure it's being maintained so that it will be ready to use if, God forbid, we're faced with another public health emergency.
Now, you had just said that only 3 pieces of equipment were actually distributed.
Yeah.
What is the process like in New York State for hospitals or other entities that are in need of specialized equipment and have to make a request?
Well, my understanding is that the Department of Health did do a survey of hospitals and medical facilities, and they did get a response from a number of them that they'd be interested in using some of this equipment, not all of it, but that they have not followed through to actually distribute the equipment. It would be done through the normal process of the Department of Health in terms of their relationship with hospitals and medical facilities.
Now, the former Governor Andrew Cuomo's team has said that it was a good thing that the equipment wasn't needed during the COVID emergency and that New Yorkers stepped up and heeded the proper guidance to stay safe. What do you think of the governor's team's defense over the last few days?
Well, I would say this. I think everyone recognized we were in uncharted territory when COVID hit. People were dying from this. So, of course, there was a strong desire to get as much equipment as possible. But I think one of the lessons learned, a hard lesson, is that in the effort to respond to COVID by suspending all normal checks and balances, and in this case, the procurement guidelines through the Office of General Services, OGS, that would normally be directly involved with purchase orders and tracking, credit card purchases and making sure, in fact, equipment that was ordered was received and the exact equipment that was ordered was received. By suspending those normal procedures for procurement, mistakes were made in terms of ordering way more than was needed and not being able to fully validate that the correct equipment was ordered, that the money was spent as intended. And I think what that suggests is that should we be faced with a similar emergency, don't circumvent the kind of standard procurement checks and balances that have worked so well. Even in an emergency, I know the folks at OGS. I certainly know the folks at the Controller's Office when we have to review a contract or a payment. If it's an emergency, we're going to expedite. We're not going to waste time. So, in the zeal to move quickly, perhaps to control everything, I think too many corners were cut in a way that did not serve the public or taxpayers well. And now that it's years later, we're still not figuring out. And so I think, look, what I think is most important about this audit is not pointing fingers about what whoever did in the past that didn't make sense. What's more important is how do we learn lessons from that time and not repeat those mistakes for the next time moving forward? And what do we do with all this unused equipment? And let's not have it just be sitting in warehouses. Get it out to facilities that could use it. Maintain an appropriate level of stockpile of this medical equipment and make sure you're maintaining it so that it is ready to go and functional. You don't want to have a ventilator sitting there for years and not being properly maintained. God forbid you need it 2 years from now in the face of emergency and it's not working properly because you didn't maintain it. So I think it's really the lessons learned from that about what we need to do moving forward that's more important than rehashing decisions that were made at the beginning of COVID.
Now, Comptroller DiNapoli, I got to ask you, right now we're speaking and the state budget is about 2 weeks late. So at this point in the game, what is the pain point right now for municipalities that do depend on the state budget? What kinds of effects do communities in New York feel when the state budget is held up?
There may not be an immediate consequence for many, but very soon, was it the third week of May, you're going to have the school districts across the state have to put their budgets out for the voters. they need to know what the state aid is going to be. So we're really getting close to the time where those budgets are going to be finalized, and they're going to have to do guesswork. Now, perhaps you could argue in a year like this, you could go pretty close to what the governor's proposed because it seems that everybody seems on board with that. But it's really that inability to plan that, first of all, is going to affect the school districts, but then over time is going to affect the planning for the counties, for the towns, for the cities, for the villages as well. If they don't know what to expect from the state government, it makes it very hard for them to complete their own budgets. The challenge on top of all of that, it's not just the lateness of the state budget. There's so much uncertainty with regard to the impact of the federal budget. There is an expectation, perhaps we'll be wrong, that there will be some level of cuts coming out of Washington. When you consider that the state budget in any given year is 35 to 40% federal dollars that pass through the state to the local governments. You could have a circumstance where a state budget is done late, and then the federal government does changes, and the state budget has to, reevaluate some of those spending decisions. So, for the local governments, and by extension, then the local citizens, 2025 could really be a year of not only uncertainty, but having to do some do-overs, and I hope that's not the case. So it really is incumbent on the legislature and the governor to wrap this up as quickly as possible, and be prepared to have to deal with what may come out of Washington, especially with regard, to cuts in education and Medicaid that many people are very fearful of.
That's New York State Comptroller Tom DiNapoli speaking with the Legislative Gazette's Lucas Willard. And that about does it for this week's show. The Legislative Gazette is a production of WAMC Northeast Public Radio. We had help from the New York Public News Network. You can listen anytime at WAMCpodcast.org or anywhere you get your podcasts. Look for program number 2516. And join us again next week at this same time for more news on New York State government and politics. For the Legislative Gazette, I'm David Gistina. Support for the Legislative Gazette comes from United University Professions, representing 37,000 academic and professional employees at SUNY campuses and teaching hospitals across New York State. Frederick E. Cole, President, uupinfo.org.